Sexual violence happens everywhere in all the conflicts in the world or in other situations of violence. Sexual violence in armed conflict is an invisible tragedy, and it has two consequences. One is that the victims will not seek care because they don't want to expose themselves. And the other is that humanitarian workers or local providers of care will not know that it is happening. So they will not provide the services because it doesn't come to them. Therefore, you really have to provide services that the victims will trust, where they will access and come and feel safe to tell their stories without having consequences for them. I can give you an example, a very recent example from the Central African Republic, where we had a number of victims that went to a hospital where ICRC staff was working. And we referred them to a health center to be tested for sexually transmitted diseases. These women actually didn't go because they were not pregnant, they didn't have small children, and therefore by going there they would have been seen as victims of sexual violence. The way that we can actually reverse this invisibility is by assuming that by default there is sexual violence in armed conflict and other situations of violence, and therefore design responses that the victims can get access to, so that we create an entry point for them. Even if we don't know how many cases and what are the patterns and trends, we know that there is sexual violence, and therefore we need to provide responses that are appropriate. We should never start from the point of view that it is inevitable that there is sexual violence in armed conflict and other situations of violence. It's like for every other violation. Rules are there in war. You know, it's not that there are no rules. And those rules have been accepted by all states. Parties to all conflicts are bound by those rules. And sexual violence is totally prohibited in armed conflict, but as well in any other situation in human rights law.